Samples from Calgary's wastewater show COVID levels are high and on the rise. While we aren't seeing that translate into hospital stays, experts warn that as respiratory season continues, there's concern that reduced access to COVID vaccines could see demand for beds rise. Here's Stephanie Thomas.
Since 2020, researchers began tracking public wastewater to detect COVID-19 and now other viruses and pathogens as well.
It's like doing a swab for 1 million people at once. And so what wastewater shows you is if the virus is going up, going down, staying stable.
The most recent data shows COVID is mostly tracking higher and higher. There's also a national wastewater dashboard, and it has labeled both Calgary and Edmonton as high.
It's especially when we see a sustained trend in a certain direction. That's when we can be pretty confident that's sort of a spread of the infection manifesting in the community.
One infectious and chronic disease expert says this means COVID is likely to return in a significant way for this respiratory virus season.
It's simply saying the virus is circulating, and we can anticipate seeing cases, starting now, but absolutely rising over the coming weeks.
However, he and others are worried the virus will have significant spread as the province's immunization program is notably different this year. Vaccines will not be made available at pharmacies or doctors' offices, and there will be a $100 fee for most people who want a shot.
They know that putting up these barriers and adding costs means that more people will end up sick and they'll end up in our hospitals, which will cost us more and add more capacity issues on our hospitals that are already experiencing capacity issues.
Alberta Health Services emailed CTV News a statement. It says there are overcapacity and surge plans for when demand is high. The impact of respiratory viruses is hard to predict, but COVID-related hospital admissions this summer were the lowest since the start of the pandemic, and the overall impact of COVID is steadily declining. Stephanie Thomas, CTV News, Calgary.
Craig Jenny adds COVID should not be dismissed as just another flu virus, though. Both are increasingly costing Albertan lives.